Hi everyone, I'm Dr. Shabiullah Syeed. I am a consultant psychiatrist at Continua Kids. So I'm going to talk about the rising levels of stress and anxiety in children and teens. So not all the children and teens respond in a similar way to stress. So I'll tell you the common changes which you could be watchful of and that you can see in your children and teens and differentiate. The first one would be excessive crying or irritation. So if you see your child or a teen crying excessively and being very irritated, so that can be one thing that he's stressful a lot. Then if the child or teen returns to the behaviors they have outgrown, like for example, they were bedwetting earlier, or they were showing some tantrums earlier and they had stopped it, but then now they have started it again, so that shows that they are quite stressful. Then excessive worries or sadness can be seen. Then unhealthy eating or sleeping habits. Irritability and acting out behaviors in teens can be looked for. Poor school performance or avoidance of school, although the schools are closed these days, but many are running their e-classes. So children these days are also trying to avoid e-classes. Then there a difficulty in with attention and concentration can be seen. Avoidance of any particular activities which they used to enjoy in the past. Unexplained headaches or body pain. Use of any kind of tobacco, alcohol and other drugs in teens can be looked for. So now if we see all these things, what a parent should do in such a scenario? So what are the things that you can do to support your child? So firstly, you should take time to talk with your child or teen about this pandemic, COVID-19. You should try to answer the questions and share facts about COVID-19 in a way that your child or teen can understand. Second, reassure your child or teen that they are very safe. Let them know if it is okay, if they feel upset, let them know. Share with them how you deal with your own stress so that they can learn how to cope from you. Thirdly, you should always try to limit your family's exposure to news coverage of the event, including the social media, because there's a lot of fake stuff going on, and then reading about the epidemic again and again creates a lot more stress. So because children may misinterpret what they hear and can be frightened about something they do not understand. Try to keep up with normal regular routines which you had earlier. If schools are closed, try to create a schedule for learning activities and relaxing and for fun activities as well. Be a role model, take breaks, get plenty of sleep, exercise and eat well. Connect with your friends and family members. Although everyone is advised social isolation and social distancing, so social distancing doesn't mean that you don't reconnect with your family members, as there are several ways to reconnect with them, and we shouldn't be taking social distancing otherwise. So these are the points which you can keep in mind and try to cope up with the stress that we all are facing in this crisis. Thank you so much.